Migraine, no? With the migraine, always try to check the masseter muscle.
Is it tension?
Yeah. This muscle, no?
Tight.
Yeah.
For example, I am suffering with emotional issues, and I am holding my jaw very tight. And this masseter muscles below the medulla bone is going and attaching with your temporal muscles. Is giving the and this is the origin part, giving the lots of the pressure in the origin part. For example, I touch here, okay, and we'll see if this one is like steep. For example, here, okay, check here. If the patient is feeling like steepness, here, or the needle here, okay, or here. If this part is steep, just insert two needle here, then they will feel the more relief. Or you can check with patient jaw open. They are opening jaw enough or not. Okay, how will be your jaw normal size? What is your jaw's normal of? The minimum should be 3 finger.
What do you mean normal jaw size?
Opening.
Opening of the jaw.
Oh, sorry. Okay.
Yeah.
Mine is less.
Mine also mild less.
Barely 3. Is good. Mine is a bit less. He's fine.
Opening the jaw.
Right? Some people can open it wider though.
Yeah.
No?
Yeah, well, open heart.
Minimum 3.
That's okay. I can open her.
What do you have? You can put 5-6 fingers.
So for us, our heart is not so.
You can hear it in your ears.
Yeah, the masseter muscles sometimes create a tension, not like emotionally or anything. Sometimes the physical tension also, sometimes different tension. So use needle here, feeling the very good.
Small mouth people.
ಬಟ್ ಇದು ಟೈಟ್ ಇದೆಲ್ಲ ನನಗೆ
Korean small love, just like saying.
ಸರ್
I said Korean. Please.
ಇದು ಟೈಟ್ ಇದ್ರೆ
Korean
We
mouth
use
so
law like
small.
this, no? The Korean people used to do like this.
ಎಕ್ಸ್ಕ್ಯೂಸ್ ಮೀ ಇಲ್ಲಿ ಟೈಟ್ ಇದ್ರೆ
I figured that out.
Tight it.
No, then they use this to.
How many?
We do this.
No, there is not tune. There is no tune. Just go 1.5 tune and press there. Okay, and just on the muscles. If you go little bit above, down, there's no issues.
ಇಲ್ಲಿ ಟೈಟ್ ಇದ್ರೆ
Is it tight itre?
ಹ್ಞೂ
It's the pressure idre.
ನೋ ಟಚ್ ಇಟ್ ಟೈಟ್ ಇಲ್ಲ
Just mild tight, that's good. No problem.
No, it's just the muscle. This is HT.
9. I think.
Just half tune backside your eyebrow, end of the eyebrow. Okay,
So that is what we should
and
try.
very superficial. And if you are using GB20 with this, that is also perfect because gallbladder and liver, they are targeting the both. Okay, then you will open the whole head.
And then you said about the ear, right?
Yeah. So this protocol for two conditions. One for mental tension and second for migraine.
And you said the final one, where did we put? You put 5, right? 1, 2, 3, 4.
Intense.
Ah.
But this one is for the back on
Yeah, GV20 only if there are.
This is just symptomatically to reduce migraine.
The GV, the global, gallbladder thing you don't need for the symptomatically.
ದಿಸ್ ದಿಸ್
HT9.
And the one in hand is HT9, right?
Yeah.
Medium.
Medium.
You want. So 1 point on each temple. chun from the end of the eyebrow. So दो needles हो गया.
Sir, which gallbladder point
And-
you mentioned?
GB20.
GB20, both bilateral.
And दो needles, one on each side, above the ear, about an inch above the ear. It is focusing on the muscle. What was the name of this?
Temporal muscle.
Temporal muscle. You don't have to worry, it's on the muscle.
वाता पित्त
Above
माइग्रेन
the top of the ear. कान के ऊपर जो देखा ना फोटो में, I mean वीडियो में.
Pitta migraine.
कान से 1.5 चुन ऊपर.
कान कान से 1 चुन ऊपर.
One chun and 8 chun. One.
बंद करो में तो भी कोई प्रॉब्लम नहीं, मसल काफी बड़ा है, यहाँ से निकल जाता है.
तेरा कैमरा नहीं चल रहा है, हमारा यहाँ चल रहा है. अच्छा. No, it is so 1 point was on or 2 points, one on each side of temple हो गया. Eyebrow से half chin away.
Sir, you go there and sit. Keep the needle for 10 minutes.
तो कोई बात नहीं बात क्लास. इसको repeat नहीं कर सकते बार बार.
You can move like this directly. Okay?
She can't do it properly. She's then missing stuff. But I have to do nothing.
There is some network issue.
Yeah, it's not easy.
Black tongue on the spleen region. If there is the black tongue in the spleen, then what will be symptoms?
So maybe we are behind, right? Based on our original plan.
What he said?
Timeline हम लोग पीछे हैं ना. चलेगा.
Glasses का ना? थोड़ा सा पीछे.
तो चार्टेड को करना पड़ेगा क्या?
मैंने करते हुए देखा. One day पीछे चल गया.
Oh, I can see the top also, but I'm focusing on the screen. Black one, yes.
On the spleen, you will not find many tongue. Mostly, what happened? You will find many black tongue on the liver, or maybe on the both liver and spleen together.
But not just.
But individual, like see, this is the spleen and liver both. Okay, and this is the liver and spleen both.
Yeah.
Okay, you can see here also liver and spleen both. Wow, this one is liver and spleen both.
ये तो पूरा ही था.
अच्छा.
बस हो गया तेरा अभी.
हाँ, ये भी स्टेटमेंट है.
स्प्लीन
Black है.
कैमरा में दिख रहा है मेरे को.
She sent in a picture as well. Kushi sent a picture. That's the spleen.
We are looking at your tongue.
No, I don't think it's hers.
Or whatever she has said.
Maybe it is. I don't know. Do you see it? Yeah.
So what does it show?
Spleen.
Oh yeah. Oh, one little dot on the screen.
Are these people having issues with iron binding capacity issues?
Oh yeah. We learned in the first few classes. Yeah, I'm finding it.
Iron binding issues. Okay. There is high chances of the ulcers in the intestines and ulcers because large intestine, sorry, mucus layer is built by the spleen, but in the spleen, if there is the excess level of the biles, which is the black biles, then with mucus, what will come?
The pile.
Bile will come. The bile will damage that
The mucus layer.
the mucus layer.
And the piles are, they're acidic in nature. Are they acidic in nature? So that's why it's ulcers.
Yeah, ulcers and little bit of the digestive issues. What types of the digestive issues?
Diarrhea.
Diarrhea,
You should just say diarrhea.
Yeah.
Diarrhea.
Yeah, lots of the sadness and worry. And these people having constantly like infection issues.
Oh. So that means low immunity. Low immunity.
Not low immunity because in the immune system, the spleen is governing immune system, but in the spleen itself having the like black bile restricted, they will create the more internal infections. In both the crucis and the tongue, if you see the back side of the tongue, there is a bump. The tongue is swollen. If you can see the crucis tongue or the cysane, the back side of the tongue, there is mild swollen tongue. Okay, that also gives the mild symptoms of the infection. Infections in the reproductive organ. You see, when she will come next time, press on the reproductive system and see.
I don't know if it was her tongue. She just sent the picture. I don't know if it's her
Whose
tongue.
tongue
Not
is
her
that?
tongue. She sent some patients to.
Oh, okay. Oh, your
Okay.
sister. Oh.
Wow.
Okay.
Okay, then Fuji or Putrika.
If this case become the chronic, then these people having the more breast cancer issues. The case become the chronic. Ajay? Ah, okay.
Breast cancer.
Okay?
Yeah.
What's this breast cancer has to do with the spleen? How is it connected?
We have lots of the small limbs here. Okay? And soft tissues which is purely done by your skin.
What tissue, sorry?
Soft tissues
Soft.
in the breast. Okay? Maximum amount of the lymphatic systems we having on the chest region. Maximum amount of the lymphatic system is here. Lymphatic system. Okay, so there is excess heat is going inside the lymphatic system and inside the lymphatic systems and the soft tissues. Okay, so that's why they become breast cancer. Okay. This is like cystic type of the cancer.
Cystic cancer.
In the liver black stagnations, you will find the cancer in the blood cancer. Liver black tongue, blood cancer. Spleen the black tongue, more in the lymph and in the breast.
Okay. Have you treated people with breast cancer?
Not really. The treatment, what I found that all was third and fourth stage of the case. I treated 3-4 patients. But side of the side, the chemo, this all was going on and I was treating, so I don't know it was effective or not.
Okay.
I have not good results for cancer case. I have very good results for fibroids, okay?
Okay.
But I tried with 8-10 people, but I didn't find any good result with cancer patients. Yeah, pain is reduced, that's good. But the report one day is very positive, second day is going up. Third day is, you know the Hanif Qureshi? You don't know Hanif Qureshi? You can search on Google, he was a very good artist. He did a good art project and so on in metro, doing that art. Somewhere in the company, in the cities, we art. He was doing a good government project. He was a very good person. I was treating him for the cancer. One time the report is comes like almost near the cure. Again, boom. 3 times this happened and 4 times.
This is terrible.
Yeah, but he was taking lots of different medicines from a different country, and but he didn't wait for chemo. Because there was expanding before hair and then the hip and going with the lymphatic system.
Chemo good or bad, I don't know. So many people when start chemo die speed.
try
One sec,
quickly.
one sec.
Yeah. Mostly I suggest if there is like fibroids in the breast or any cyst, no. Mostly I suggest to surround the needle here,
Around the cyst.
around the cyst. That's the very good result.
Resolve the cyst.
Resolve the
So
cyst.
this is non-malignant. This is because
Yeah, and after that what I do, I use the range 17 and near the range 17, for example, this is your external, no? Okay, I use 2-3 needle here. 1, 2, 3. 1, 2, 3. Here needle more. So this is like I show you.
Space between that is the muscle, I think. So,
For example, this is the this is the leaf. See. Now, can you see this chest? On the chest, can you see this line? Okay. This is line. This line is just next to sternum. Just close the sternum. So we target one needle between 2 rib, here, 2, 3, half of 2 needle. Don't go more deep, okay? We'll give the needle here, one range 70 and 2, 3 needle just next to sternum and between the 2, 3 rib. Oh, Nanya. Okay, one needle for the sternum, range 70, 2, 3 needle between the 2, 3 rib here. Okay, and give the deep moksha. And if you want, you can give put a little bit of the ginger here above the range 17. Paste of the ginger here a little bit. Means just ginger. And give the deep moksha here. This treatment is very good for the congestions in your lungs, in your nipples. Okay, if there is lots of the congestions, cold and cough. Okay, and there is some issues in the breast. Okay, in this condition,
Cysts also, cysts.
yeah, for cyst also, and give the deep moksha.
Yeah.
See, I'll show you 3-4 points. One for range 70. Here. This is the range 70, no? This is your range 70. Okay. So range 70. One needle here, one needle here, one needle here. Just near the sternum, between the 2 rib needle here. Okay, near the sternum, needle here. Okay, and put little bit ginger in this area. Put the ginger. Okay,
Yeah.
and put the ginger here and give deep moksha on this whole needle and ginger. Okay, and where is the cyst? Just round that cyst on the sternum. If you are doing like this also, no, this help a lot to melt that cyst, because this lymphatic system is directly connected with your breast lymphatic system. If you see the lymphatic system, they both are internal connected, very close. This help a lot to circulate the congested lymphatic fluid. What is the cyst? The congested some toxicity.
When you say ginger paste, what do you mean? How you take a
You
Crush
take
the
a
ginger.
little piece of ginger.
the crushed ginger, not the.
In a
You grate it. You grate it.
in a pestle and
Yeah,
mortar.
okay.
And see here now again, I thought cysts were kapha because they're congestion, but there's cysts that are kapha and cysts that are pitta.
Congested, for example, sometimes acid also congested.
Okay, so some cysts are
But
acid.
see, this both biles is like juice biles. The acid or no, these are the mixed with juice. For example, if you see the black biles, no, black bile is not the proper structure way and solid way. That is going with the juices only. Okay, so you can count like that negative charges fluid and the pitta. Okay, so for example,
Oh, it's the negative water part of the pitta.
okay, so this is congested here. So you can, when you will give, because after congestion there is the kapha. Anything which is congested,
Yeah.
after congestion not moving, that will convert slowly into kapha. When you give the needle, they will melt all stagnated kapha. What all toxicity is stagnated, no?
Yeah.
When you give the proper deep moksha, they will start to melt.
Yeah.
And they will come in the circulatory system again. Once they will circulate, your immune system will heal that. But if there is congested, because how they build a strong boundary here. Okay? And all toxicity here, and slowly the boundary is expanding. Once you do the proper heat and block this boundary, okay? Once it's entered, when your immune system white blood cell will enter inside, they will melt your cyst, they will take in your immune system and they will take out flesh from your body. To melt the cyst, that is the more important thing.
So you give moksha to these even though it's an acid cyst.
So this protocol we use if there is a cyst in your breast.
Yes.
Okay.
Yes.
Second, if there is lots of the congestion in your chest, someone is coughing a lot. Okay, phlegm is coming a lot.
Lupus, lupus,
Eh?
lupus.
Lupus. Okay, someone is having pneumonia issues. You know pneumonia?
Yeah.
Pneumonia issues. In that condition, you can use this protocol.
Or just condition.
So for if it's a kapha cyst or pitta cyst, you do moksha.
Yeah, we do moksha. Which is congested. No, the cyst is congested now.
Okay. Is there such a thing as a cyst that's not congested?
No. Of course, cyst is the congested only. Okay, for example, one of when we got to play the patan, there was one patient, and he was coughing a lot, taking the antibiotic, this and that, and the still coughing was not stopping. And I said, "You just come for 1-2 days, we'll fix that." And I did just simple 2 protocol, and all the cough reduced. Okay, it become like within 2 sessions he became better, and he was taking 15 days medicine, but there was not improvement, just few percent improvement.
You were doing moksha for a long time, were you? Moksha for a long time.
Yeah. Deep moksha, at least 20 minutes.
ಇದೇ ಪ್ರೋಟೋಕಾಲ್
Because the ginger take time to convert into heat, because ginger is that weight, no? The ginger is weight, so it take time to heat.
And ginger is anti-inflammatory.
Antibiotic.
Antibiotic, anti-inflammatory. So you can use like monthly once. This protocol is very good to cleanse your chest, to cleanse your lymphatic systems. Okay, this like sometimes you can use this protocol. Don't go needle more than half chun. Okay, well, you can leave less than half chun. There's no issues. Do not put on the black spots of the breast, but around area you can use.
And if it's benign or malignant, you can do for both.
Do not insert on the black tip point of your breast.
The nipple.
Nipple. Yeah, you can put half chun. For the female, do not insert half chun for the male. Male is more superficial.
Pain.
In the breast, that is just soft tissue, so don't worry about that. That's very good.
Yeah.
There is in acupuncture many points used for that. Yeah, the toxicity is congested. There is not enough circulation. There is no more circulations. What they have, they just all congested there only. That is just fibers.
That's pitta as well.
Pitta and kapha both combinations.
protocol, same protocol.
Yeah, this
For these fibers,
Yeah.
this fibers we use the reparative protocol.
Reparative PCOD thing.
PCOD.
Yeah.
You can use it
That
for
really is.
benign and malignant cysts, both. benign and malignant cysts. Like if it's cancerous or non-cancerous,
Yeah,
you
you
can
can
use it
use
for
it.
both.
Then one more thing, there is lipoma. Do you know that?
Yeah.
What is the lipoma?
It can
Lipoma?
be fat.
The fat cyst. In many people you will see the small
Ah.
fat cyst.
Flat,
in the-
fat
yeah, yeah, yeah.
nodule.
Hmm.
That we'll discuss later. You have that?
I have one here.
Yeah,
Yeah, one.
That's a
It's
kapha
It
aggravation.
forms a little.
that will come later. We
Some
have
people
one
have
protocol for
full
that.
hands and legs.
Yeah.
Up.
Here is very common.
क्या हुआ?
Just a little,
Nodule.
yeah, like a, I thought.
क्या बोल रहे हो? Yeah. When we'll come on the kapha, we'll do that.
Oh, really? Okay, then I thought I had some.
Yeah, because
On my
the
legs.
malignant cysts are definitely pitta cysts because they're acidic in nature, yeah?
Maybe yeah.
But the fibroids is fluid, so it's kapha in nature, no?
So that is caused by what? Those lipoma.
This Dhatu's process, when your fat
Oh,
is
the
not,
adipose, the fourth
when your
one.
fat is not able to absorb the, to filter the proper and not give the nutritious protein to your bone.
Yes.
Okay, when we come on the kapha, they will discuss. That was very simple protocol. One of the patients, that patient had 23 cysts in the body. Okay, so within 3-4 sessions, that all resolves very fast.
Oh.
So in that condition, we will not use to surround. If there is 1-2 needle, you can surround. If it is all over the body, how you surround?
Right.
Can you not?
And that is mostly connected with your immune systems too.
Okay.
Can you not put it directly on it?
You can put no problems, but directly on is not.
It's not good.
Gravitating like this. Okay, surround is not good.
So can we use the
The guy
use
you
around
use
the
that
patients for something called this hernia?
The French.
Somewhere
You can use that.
around
You can use that. But for hernia, we have the one good protocol.
Bad.
hernia.
Okay.
So we can also put around.
Yeah.